Hi, and welcome to another Veterinary Compassion Project podcast. I'm Dr. Erin Holder, and today I'm with Dr. Jody Bearman. Dr. Jody graduated from University of Minnesota College of Veterinary Medicine in 1992. She worked in a small town practice seeing horses, farm animals, and small animals, and then in a small animal and exotic practice using Western medicine for 16 years. Wanting to help animals that couldn't be diagnosed or treated with Western medicine and those that developed severe side effects from Western medicine, she took the Chi Institute for Traditional Chinese Veterinary Medicine mixed animal course and became a certified veterinary acupuncturist in 2005. She is certified veterinary Chinese herbalist and practices tui-na, which is Chinese massage therapy and physical therapy, and she practices food therapy. She took courses in Advanced Applied Kinesiology and became certified in Veterinary Spinal Manipulation Therapy at the Healing Oasis Center and is a member of the College of Animal Chiropractors. Dr. Jody is a graduate of the Pitcairn Institute for Veterinary Homeopathy and is a certified veterinary homeopath. She's a diplomat of classical homeopathy and certified classical homeopath and has spoken at the Joint American Homeopathic Conferences for several years. Welcome, Dr. Jody.
Hi, Erin. Always good to see you.
So happy. I'm so happy to see you as well. I'm so happy to host you. And can't wait to talk about one of my favorite topics, which is homeopathy. But before we get into that, let's start off with your journey into veterinary medicine.
Into veterinary medicine, like how I became a vet.
Yeah.
Well, I think I wanted to since I was a pretty little kid. Um, my dog was my best friend growing up. I'm sure you've had a lot of people say that. And cat and other dogs and of course then there was the horse that I got without telling my parents and
Wait
and
a minute. Please
yeah.
pause for that. Let's explore that for just a moment.
Well, well, I'd taken riding lessons for a long time. My aunt and uncle were wonderful and got me riding lessons for my birthday, starting when I was 11. And I went to a riding place where they really didn't do anything. It was kind of horrible. But as a little kid, it was great. You just went on, jumped on horses and rode around, went out
Those
and
were the good old days.
yourself, right? Right. I mean, dangerous, but fun. And oh, those Gen Xers. And then dangerous but fun. And then my best friend in high school was like, just let's buy a horse together. And I'm like, okay. And we built a pasture. We went to some used horse dealer and that's what we called it. And just bought a horse for $100. So we each paid 50 because we both had jobs. And there you go. And then eventually I sold my half to her and bought my own. And my parents found out when I had to go to the hospital because of it. So yeah, but it was totally worth it.
Oh, yeah, absolutely. So, so you knew from a pretty early age that you wanted to be surrounded by animals.
I did. I did kind of change in college a little bit because everyone was saying at the time, you'll never get into vet school. It's super hard. Nobody gets in, especially women at that time. And I was in this. I majored in bacteriology because it was easy and I loved it. And then I was in an organic chem class, and some of the other people in the class with me would meet afterwards. I went to the University of Wisconsin-Madison, which is party school. I mean, hard, but also party. So we'd always go to the Union after our exams, and so we were drunk at the Union as often. I hope I'm allowed to say that. And
Absolutely.
and one of
Like to
my
keep it real here on the VCB podcast.
and one of my friends in the group who is a veterinarian these days too, became a veterinarian also. Um, Said, "Well, Jody, you can't get into vet school if you don't take the tests." And I'm like, "Tests?" And he's like, "Yeah, you got to take these tests." And back then, you had to take something called a VAT, veterinary aptitude test, and then you also had to take a GRE. And I didn't know anything about it,
Yeah.
and I was really clueless. And so I just signed up and to take the test, and I didn't know people studied. I had no idea anybody studied for this stuff. I just thought, well, for a test, you're supposed to eat a good breakfast and get a good night's sleep. So that's what I did. And I did very well. And I got in. And so I went to Minnesota because that's where I went, and my professors here in Madison, it says nothing about Madison these days. It's a great school, but it was a brand new school back then. I started in 1987. And my professors here are like, you should go to Minnesota. And I'm like, okay, I mean, oh, let's see. And it was a good choice. And there you go.
Cool. I love that story. And so you're in vet school, you're in this newer vet school, and
I was in an older vet school, Minnesota.
oh, you went to Minnesota because the Wisconsin one was the newer. Got it. So you
Right,
went,
right.
okay, okay, got it. Sorry about that. Okay, so you went to Minnesota, very cold. Wait, you're still in Minnesota, aren't you?
I'm in Wisconsin, but
Now you're back in Wisconsin. Okay.
I'm from Minnesota.
Okay, okay, got it. All right, so we're set there. So tell me about vet school, like that experience for you, and then after, because you chose to do Western Med for a long time. So share with
Yeah.
us that journey.
I know we don't have like days to talk about this, but vet school was something.
That's something.
It was something. I started out in one class, and the class that started, the class of 91, which I did not graduate from. And I had a really good friend who was, you know what? I don't even know if I can talk about it. I'm gonna cry. What one of my classmates was my lab partner during histopath. And this didn't happen in vet school, but we became pretty good friends, and he was married, and he and his wife would have me over for dinner. I ended up breaking up with my boyfriend. My husband shouldn't watch this. Um, and and going out with another vet student, which was just stupid, but I know it was because I really needed to deal with some personal stuff, and it brought all that up. And then I was in therapy. And then we had a group of women vet students that met together. But then then they're like, well, you could go to a therapy with somebody from, on the other campus. The St. Paul campus is where the vet school was, and Minneapolis campus is what almost everything else was. And so I started therapy, and that messed me up. I mean, not bad. It's, it was good, but it got things stirred up, I should say.
Yes, it's what it
Got
does.
things-
Yeah,
Right? Got things
that's what
stirred up,
talk therapy does. Yep.
and it was very distressing. And anyway, brought up all this stuff from my childhood. I had a very, very, very rough childhood, and and undergrad was just a party. I mean, I studied really hard, but I also partied hard. I had a really good time, and it was away, and so it was great. I wasn't dealing with that.
Yep.
And then when I came back, then again, I'm where I grew up, and then I'm dealing with all this, and so it was really hard. And I brought up stuff in my family. Sorry, my cat's doing stuff. I brought up stuff with my family members, and then my mom decided to leave my dad, and I was kind of afraid for my life because of some things that he'd said when I was a child, and that he said at that time. I was afraid what he was going to do. So I decided to take a year off of vet school,
Yep.
and I left. I took all my waitressing money. Oh, and I broke up with the boyfriend. Yeah. Anyway, I took all my waitressing money, which was a lot of money, way more than I made as a vet for like the first, I don't know, 5 to 10 years as a vet. I made way more as a wait person. And I took that money and bought an open-ended round trip ticket to Amsterdam for a year,
Oh,
and
yeah.
a year ran past, and I left by myself. And I traveled, and it was great, but it was also distressing because I was having a really hard time. So, you can't run away from your problems. You can't. Yes, I'm really glad I did it. There's no reason I'm not glad I did it. I had a lot of adventures that I will not tell you today, but there are some really, really good ones. And oh my goodness, Jimmy. Okay, this is Jimmy. He is
I
trouble.
love Jimmy.
Yeah, he's like, yeah, I'm trouble.
Welcome to the podcast.
Um, but he's my love. And what are you going to do now, Jimmy? Oh my goodness. Okay, let's move you over here. Anyway, um, and the vet school was really nice about it, actually. The person who was in charge at that time, he's been gone a long time. He's like, well, we really want you back. If you're going to take this year off, we really want you back, so come back.
Nice.
And so I went, and when I came back, I talked to I started working at a small animal clinic, and it was horrible, absolutely horrible. And I never wanted to do small animal because I don't like being inside.
Yeah.
And it was horrible. They had me cleaning the runs with a toothbrush
Oh my God.
and washing the
What
syringes,
in the
washing the syringes to be reused, right?
veterinary hazing?
It's just it was the old guy who ran the practice. Sorry, it
Yeah.
was.
Yeah.
But there was a really nice young vet who always wanted me to come watch the surgeries, and she made it interesting. But then he'd get mad at her and
Um,
me for allowing that, because I'm supposed to be washing syringes and cleaning grout. And anyway, so then I talked to some of my friends from my vet school class that I had been in and said, I can't do this. And one of my friends um, said, hey, I know a really good woman dairy vet out in the country, and I think you'd be really happy if you go see her. Because I'm like, I don't even know if I want to be a vet. I hate this. I can't do this. And so I went and rode with her. Oh my gosh, Holly Neaton. What a gem. What a gem. It was fantastic and it brought all the joy back. And so then I went back to vet school and I was in a different class and my classmates were great and I missed my old classmates, but I'm really happy to have the ones that I did. I did I finish telling you about that story about my um lab partner? I didn't finish saying that before.
no.
Yeah, after vet school, maybe a couple years after vet school, he died of suicide. So that is a big thing. And I had a lot of that. And my childhood vet that took care of our animals also died of suicide when I was a child. So
Mm.
back in the 70s or 80s.
You've
Um,
been you've been surrounded by that. Yeah, I'm so sorry.
yeah, yeah. So that kind of sucked.
Yeah.
Um, but then I got out in practice and I took a job at if you are not a vet yet, do not do this. I took a job at a practice because I had no confidence. And
Um,
I had a little confidence. I had just gotten good at palpating cows. I mean, it took me a while. I was slow.
yeah.
And I'd just gotten good at it. And I went and tried out this place, and everyone's like, don't work there, don't work there, don't work there. And I was a good palpator. And then he's like, oh, great. Okay, I'll hire you. Well, don't do that. If everyone says don't work there,
Don't work there.
work there, right? Don't do it.
Right.
So I loved the work. I loved it. Back then, remember, this was 1992, so there was no internet and I had to use plat maps and it was a mixed practice and a lot of dairy. And so lots of times the hardest part of the job was where do you live? And there were a lot of Amish farmers and they're like, well, you know where Irish Ridge is? No, Irish Ridge is a ridge of land, not a town or anything.
Right.
Right.
Name
And
period stuff.
right, you know where Joe Schmo lives? No.
No.
You know where this town is that's not really a town? Well, I did. So anyway, it was an adventure. The adventurous part was trying to find the farms. That was the most adventurous part. And then also my boss wasn't kind to the animals or to the people.
Mm.
Um, and that was really hard for me. And finally, I just sat on the side of the road by my husband, just crying. And he's like, well, can't you just suck it up, or he didn't say suck it up, but can't you just try? And I'm like, I'm trying. I can't deal with this. He threw his own dog out of a second story window.
No.
Huh.
No.
A
Like what?
pug.
Just
He told me that and laughed. My boss. I'm
gosh.
like, what?
That's traumatizing.
So anyway,
I mean,
e-
obviously for the dog, but for the humans around him, like he's traumatizing the humans around him. Yeah.
exactly. And then and he was just horrible to the clients, especially if they were women, or especially minorities or minority women, even worse.
Um,
So I just couldn't take it anymore.
mhm.
So I got another job, and that place, I took that job because of one of the other vets there, who's a woman who I still adore and who's a great vet, and yeah, just a fantastic vet. And I took that job because of her, because she was wonderful. The boss and his wife both worked there. Don't do that either. Um, but
Right.
there was
I
an
second that.
right, it was an abusive relationship, and so that was really hard to witness. And then I was in a horrible truck accident, and I was unable to walk, and I had all the ligaments torn off my neck. The vet pack came through the back. I was going to
Oh,
do it. I did a bulldog C-section in the middle of the night, and as I was coming back, there was an ice storm. And I had complained about this truck before to my boss, as had the other vet. And turns out they had another one all along after they said there's nothing we can do. And his wife, as she was taking me to the emergency room, was saying, "Oh yeah, you're lucky because we figured somebody would die in that truck."
What the freak?
Right. So there are lots of stuff.
Yeah.
And
Gosh.
anyway, um, I couldn't work. And so I decided I needed to do something. I mean, it took a while before I could do anything.
Yeah.
And after a while, my friend, a good friend of mine who was a college roommate, who's still a really good friend of mine, and our kids grew up together and everything, she is a social worker in town. She said, you should really look at volunteering at Briar Patch. And so Briar Patch is a teen crisis counseling center. And so I did all the training for teen crisis counseling and I started doing that. And then then I took more training and I became a family crisis counselor. It was great. Well, the teens were great. The families weren't as great. I had a harder time with that.
Sure. Yeah.
But that was great. And then I had to get another job because I really had to get another job, even though I was in excruciating pain every day. And
Mm.
so I did get another job and at a small animal clinic, and I was the only vet. Um, and every day I would lay on the x-ray table with my knees on my chest crying because I was in so much pain. And so one of my coworkers started going out with a chiropractor who I still know. And that helped a lot. And
Nice.
I was getting PT in the meantime, but they were just putting like heat on my back and massaging me, which was lovely, but it didn't help particularly. And then I started getting acupuncture, and that went well. The first acupuncturist didn't go well at all. I was so sensitive that like I couldn't get off the table. And then they were afraid to treat me. And then I saw another acupuncturist, and that helped. And anyway, then I'm like, this is interesting. And then I started seeing somebody who did yoga nearby and trying everything I could to get better for myself. And then um, I went to another clinic after a while because that vet wanted me to lie on a health certificate. And I'm like, okay, I'm done. And
My gosh.
right. So then I went to another clinic, but the people were really nice. And those people are very nice people, mixed
Yes.
practice, but I was just doing small animal. And I took that job because of the technician who was there, who was lovely and wonderful. And then she left. She didn't want to continue being a technician. She became a CPA. So then it wasn't as much fun because she was gone.
Yes.
And and I had my kids in that time and had a lot of Oh, well, okay, this is too long of a story, isn't it?
No, it's okay
Long
actually, because
story.
the importance
Well, I had,
of the importance of this is that you had like all these experiences in these different veterinary hospitals and you ended up just walking away from it and saying like I'm not going to stand for this. I'm going to find somewhere else. I'm going, and kept your journey going to find places that you felt comfortable and good. And I think that's a really good lesson for all of us to learn. Like we don't have to stay in a place that's not good for us.
right, right. So then a friend recommended another clinic. So I went there and it was close to my house, which was really nice. And I just eventually, the people are really nice, but it's just the culture of conventional medicine for me that I couldn't handle. I mean, the techs and the vets are just like popping pills all the time. Not anything illegal, but like Clavamox. Like I have a cold, I'm going to take Clavamox. We know that doesn't work for viruses, right? But it was just constant and it was hurried like most practices, right? I mean, no one there was bad or mean or anything like that.
Right.
But
Short period of time to see the animals, get the diagnosis, get the treatment, get them out the door.
right, right. And I'm just like I don't feel good about this. I don't, and then I paid off my student loans. So it took 15 years, and we ate rice and beans for most of that time and really didn't do anything else. And so then I'm like, I want to take this money instead of thinking, oh, I'm going to put this in like accounts for my kids or something. No, no, I did not. I said, I'm going to take this money. I'm going to take Chinese medicine courses. So I started Chi and I loved it. I loved it. I thought, this is crazy.
But if
What?
you got certified in 2005, you were there in 2004. Is that
2004, 2005, somewhere around. I
because
don't know.
I was there in 2005. I think
Okay.
I was the class of 2005. And I was just like, did we go to school together and not
I
know.
don't know.
I know, that's so cool, but maybe you were in 2004. Well, it took me then after I finished school, I was like, "I'll write my paper and get certified at some point." And then I think it was like 8 years later, we're like, "Well, I should probably write that case up and get certified." 8 years after practicing acupuncture.
Okay, all right, get it done,
Yeah,
right? I did kind of that with my veterinary homeopathy too, so don't feel bad.
right, right.
So I went there and then I was just like, whoa, you know how you feel like, whoa, and like what? And right. And stretching
Yeah.
your brain and making friends and I had already been doing Qigong every day since
Oh,
before I was pregnant with my youngest child. So I've been doing it probably since like 96 or 97. So doing Qigong there was really great too. And Tai Chi, I mean, that was fun. And then, um, and then when I was done, I just told my bosses I quit.
yeah.
Quit. And is it okay if I just rent a space here and see patients here? And they said, sure. So that, which was very nice. And well, I think I paid them a fee or something like that of each appointment or something. Don't do that. Don't do that. Pay a set. I mean, you might start out that way, but then you really need to change it to just a set monthly fee. I didn't start that way. And then I'm like, wait a minute, you're taking all my money. But
Great
it's
advice.
a whole different
Yeah.
story. And it's not their fault. It was my fault, for
Well, we
doing,
learn it. We make the mistakes. My
right?
God, we can write a book on the mistakes I made learning. Yeah.
Right. And then, so then I had my own business and I'd been in town for quite a while. So I knew a lot of people, but at the beginning, I wasn't that busy. And the great thing was my kids were at an age where they really needed me around. They were in musicals. I went and assisted with all their musicals. I had a lot more availability. And I could see patients whenever, when they were in school, I could see patients. And so that's what I did. And I did horses and other large animals too, and dogs and cats. And then one of my friends who was kind of helping me a little bit is like, you need to hire me because I was on the phone with clients at night every night and my kids were young and they needed me.
Yeah.
And um and she's like, your kids need you. I'm like, oh yeah, yeah, I should hire you. And then she told me all about like how to get a BlackBerry. That's how long ago it was. And and how to like do the computer stuff because everything was paper. And so I
Yeah.
had a huge learning curve and I had a lot of trouble with that. Um, my office was a place that I dreaded to go.
Yeah.
So I'd be like, no,
Buried in the paper, right?
right. And then I thought, well, I need to learn more because I haven't learned enough yet, and I haven't spent enough money on continuing ed yet. I have to spend like everything I have. So, so then, so then I did the herbal medicine. I did all the herbal medicine courses at Chi, and then did um, I did the tui-na course, but I didn't write the paper. That's why I'm not certified. But I use it all the time. And I did the food therapy, but I never did the final thing either. And then I started teaching there which was great because you learn a lot more when you have to teach it. And
Yeah.
then a friend from the class said, "Hey, could you do relief work for me?" And I'm like, "Don't you live in Hawaii?" And she's like, "Yeah." And I'm like, "Oh, yeah." But we had to plan it like a year in advance. And then I went there and did some relief work, and it was fantastic. And she did homeopathy. And oh,
Oh,
totally forgot to say this. When I was in vet school, when I started with my new class, the class of 92, one of my classmates said, "Hey, you're one of those weirdos who wants to do something alternative. Would you like to join other of us and meet with this local veterinary homeopath once a, I don't know if it was once a week or once a month. We did it
got
for like,
exposed to it early. Oh, that's
it was
awesome.
early. It
Yeah.
was 90, 89, 90, something like that.
Nice.
Anyway, we did. And we learned some stuff, but then I kind of sort of forgot it because we all didn't think he was that great of a vet because if it didn't work, he just threw steroids at him. So that didn't impress us.
Oh,
I
faith.
mean, we
Yeah.
were in school, right? So I already had some basis of homeopathy, a little bit. And we read Dr. Pitcairn's book within
Nice.
that group, right? His original book. And so when I moved to Hawaii, then I already knew a little bit, but only not really. But somehow I just knew things. I mean, this was weird. Like I would my boss there wanted me to give a drug, or a dog had Demodex. And I said, "Oh, that's easy to treat with Chinese medicine." She goes, "No, I really want you to use this medicine to give to the dog with Demodex." And I'm like, "Well, why would, we do a lot of Chinese medicine here. We could do that." "No, no, I want you to use this drug." It was Promaris, this drug that got taken off the market because of horrible side effects, right? I opened the pack. I don't think it touched me or anything. I think it was just the smell of it. I fell on the floor.
Oh my
I
God.
couldn't get up. And she went and grabbed me some Nux. And then I felt even worse, like I couldn't even breathe. And I said, snake venom.
What the
And
heck?
so she gave me the homeopathic remedy, Laxasis, and I got up and I was fine.
Oh my God.
And and um and I don't know where that came from. It just came in my head. It was like just like coming out of my mouth. And
Yeah.
just like weakly because I could hardly breathe. And then I was okay. And I'm like, okay, that's weird. What is going on here?
Medicine. Yeah.
Right. And so, why do I know something about homeopathy and why would that come into my head? And so then, like, she didn't really have, we were busy. So she didn't have time to really teach me anything. She just didn't. We just didn't have time. But if she wanted me to look something up, she'd say, "Hey, go look at that green book." It was Franz Vermeulen's book. And I would go look it up. So she gave me this one case that the dog had been so itchy and she tried everything. She'd done some homeopathy, she'd done Chinese medicine, she'd done conventional medicine, she did everything. We did conventional medicine there too. We did surgery, everything else. Um, and said, "I don't know what to do with this case. Here, you take it." And so maybe it's just a fresh eyes thing. And I just
Yeah.
went to people and I said, "Hey, when did this itching start?" "Oh, it started when she was attacked by another dog. She was terrified." And for some reason, the only remedy I could think of for being absolutely terrified was the homeopathic remedy aconite. And so I went and looked it up in the green book, like she'd said to do, and it said itching. And I'm like, okay. So I gave the dog a dose of aconite, never itched again.
What the heck?
Right? So I'm like, okay. I knew there was something to that. And because I was already had been so freaked out that Chinese medicine worked, and I'm like, what? Why does this work? Well, I just have to accept that it works. I wasn't as freaked out about homeopathy working because I'd already gone through that freak out of like, what? And
Yeah. The
so
whole your world gets flipped in Chinese medicine. Like you're just what
totally,
it does is it just helps you open up your eyes to other possibilities instead of being so like, just going down this path of medications.
exactly. Exactly. And I remember even in Chinese medicine, after when I was just working for myself, I thought, why is this working? Why is this working? Well, you just have to accept that it does.
Years later, clients would call and be like, I'd do an acupuncture session. They're like, my dog just got up and walked. And I'm like, really? Really? Wait, yeah, that's amazing. Of course they did. But it's
Right?
just stunning how well it works and why, like, everybody's not doing it.
Right? So eventually we moved back to the mainland, and my boss in Hawaii wanted me to come back and do relief work and wanted me to take chiropractic courses. So I did that. That was really hard, hurt my brain a lot, and I had a stroke after that. Not, I'm sure, not because of how hard it was. But then
Yeah, don't scare
it
everybody.
felt like it though. Yeah, right. No, no, it was because I mean I was just menopausal and anyway, that's a whole different story. But then I went and took the pit caring course. And then after the pit caring course, I'm like, I still don't get it. I mean, again, I'd had a stroke, so my brain wasn't really right. And I'm just like, I don't really get it. I don't really get it. And then a client said to me, "Hey, I'm going to take this human course. You should look into it." And I'm like, that's where my homeopath went. And so I called right away. And then they had me take a test and had to do an interview, and I started immediately and
Awesome.
a human school where I now teach. And that was mind blowing. The I love the Chi Institute because Dr. Shea is like one of the nicest people on earth. And he's just so kind, right?
He's
Just
amazing.
wonderful. But the thing that I got out of human homeopathy school that was completely different is that you are supported. I mean, again, he supports you in the Chinese medicine course for sure, but it's a different kind of support. In all of the veterinary training I'd ever done, it was more like, just learn more, just learn more, just learn more. I mean, of course, Dr. Shea was nice when I like did something stupid and he had to stick a bunch of herbs in a hole in the back of my knee and stuff like that, really kind. But in the human courses, it's more about how are you? How are you? How are you doing with this? How is this for you? Because it's how it affects and how. these remedy states feel to you that you learn it. You learn it through yourself and
There's
through
a
how
great,
it affects others.
yes, there's just a great deal of healing that goes on. And so I love the thought of having different whole, of course, I've always been integrative veterinary practitioner since I graduated, the moment I graduated from vet school. But what I love to do is to have different holistic practitioners on because I feel that part of the reason that not the whole reason, there's a lot of different reasons, but one big part is that when you practice Western medicine, you have a lot of failures and you have a lot of situations where you administer a medication and yeah, maybe it doesn't work, but maybe it makes things a lot worse. And to people who are so deeply compassionate, beautiful people. I mean, veterinarians are like the most beautiful people, and their whole job is to take care of these animals, and they feel this so deeply. And so when something goes wrong with the Western medicine, maybe a misdiagnosis or maybe a medication of allergy to it, or just not working and not helping because you're not treating root cause, it leads to this frustration and feeling like, what am I doing? Like, why am I doing this? And so an exit ramp off that to me is trying to find holistic medicine and working towards finding root cause so that you're reinvigorated by veterinary medicine. And so that's why it's so important for me to have holistic practitioners on, and particularly you as a homeopath, because we get so much flack. For listeners, I don't know if you know, but I am in homeopathy school as well, and it is the most incredible. I went through the Chinese medicine. I love Chinese medicine. It's beautiful. Acupuncture is beautiful, but there's something very different about homeopathy, and I'm super excited about it. And the reason I'm in this homeopathy school is because I met with Jody and she's like, do the school. And I hung up the phone and signed up for the school, immediately was in. So I'm entering my second year of school and I'm just like blown away by it. But, the thing about the foundational healing, like you became pretty much just a homeopath. So tell me about your journey, like with this type of medicine and seeing the healing and being able to say, you know what, I can leave most everything else behind. Not everything, but most everything else behind.
Yeah, well, I still do a conventional exam, a chiropractic
Absolutely.
exam, a Chinese medicine exam. And I do see some animals for just those things too. Um, but with homeopathy, what happens is um, you find who someone is, and based on who they are and what symptoms or signs, we say in veterinary medicine, of course, instead of symptoms, but I do see humans too, so that's a little different. Um, and what signs they have, it you can figure out which remedy out of, now there are a lot, there are like over 8,000 remedies. We don't tend to, in veterinary medicine, we tend to use more kind of a general, maybe 150 of them, but I have used some that are outside of that. Um, but still, that's a lot, right? And you have to know who somebody is. So an intake is long, and we really, really listen. So it's really great because you get to learn who someone is, how they're going out of health. And based on that, we use a repertory, which is a book that helps us figure out what remedies might come up and then decide amongst those remedies which ones fit this particular patient. And when we give it, the patient starts to heal themselves. So it's not like it's a suppressive medication. And we all know like Apoquel is a suppressive medication, right? And they say that it suppresses the itch. So in homeopathy, we don't want suppression. We want the body to recognize the problem and start to heal itself. And then they tend to heal from top down. Well, in an animal, four-legged animal, will be front back. Pretend it's a bird. So it'll be top down and then inside out. And sometimes they need different things based on what happens to them. If they have illnesses or injuries or things like that, they might need an acute remedy. But lots of times they need a remedy that just matches themselves. And lots of times in animals, I see that's all they ever need. Lots of times. In humans, I don't see that as much, but
Yeah,
people are more complicated. But
always.
yeah, but there are animals where you need other things too. But in fact, I just saw a dog yesterday. Okay, so um, She didn't really want to eat this summer. She's a corgi. She's a little cutie pie. She's maybe five-ish, and a spayed female. And she just felt like cruddy and crabby sometimes, and lethargic and not eating. Would eat her nighttime treat, and that's about it. A lot of days. Um, just didn't feel well. And she felt kind of puffy. And I'm like, that's weird that she didn't lose weight when she's not eating. And the person's like, yeah, that's weird. She didn't lose weight when she wasn't eating. And I worked up the remedy. I ended up giving her a particular remedy. I gave it to her, and I swear by the time we were done talking, she looked different. She didn't look puffy anymore. I didn't think she was puffy. She didn't feel edematous. But afterwards, she had a waist. She didn't have a waist before she started. Her coat even got shiny. Now, sometimes that's not good if you see immediate change like that, but I think this dog really needed it. And it was a really good remedy for her. And you can see healing even faster, especially in acutes, sometimes faster than you can give epinephrine. So I
Wow.
said, okay, can I give an example?
Yeah.
Okay, so I had this another example. I had this beagle patient who had been a rescue beagle from a place that did testing on beagles. So they would never tell him what they tested, but it sounds like it was probably not great. Um, it, it- some big beagle testing place. Anyway,
Mm.
this dog was very fearful and angry and attacky, very, very bitey. I could really not handle this dog. Luckily, the owner was a vet tech. And so she was able to muzzle the dog. I mean, nobody could handle this dog. She could sort of handle this dog. Well, she had a child, and the vitamin D fell off the changing table, and the dog ate all of it, a whole bottle of vitamin D. I want to say it was vitamin D, right? Vitamin D drops or something you give a baby, right? So um, that amount of vitamin D would cause kidney failure.
Absolutely.
And they did, and this was a tech, so she brought the dog in, and it was already in kidney failure. I mean, like really fast, BUN creatinine super high, urine isostonuric. So I'm like, well, do you want me to treat homeopathically? I mean, what am I going to do? And she's like, yeah, can you? And I thought, how am I going to get in this dog with? Well, they had the muzzle on, and it was a basket muzzle. I was able to get it. I think I just got it on the nose of the dog because it can absorb through mucous membrane. So you can put it like on the nose of a cow or nose of a cat or dog if it's small enough, or if you do it in water. Dog completely healed.
Unbelievable.
Completely healed. Everything went back to normal. Everything.
Two things that I need to say that are really important, especially to our listeners, is that the biological sciences are just behind the physical sciences. And what we're finding now is that this quackery medicine, that if you search for homeopathy on the internet, you find so much just negative information about it, and actually incorrect, like across the board incorrect information, is that way back when this was discovered by Hahnemann, he said, I don't know why it's working, it's just working. And now our physical sciences are able to measure what is actually in the water, and that the remedies that we're giving actually have substance to it. They have something in the water, and our biological sciences are still way behind. So now there are so many studies out there about homeopathy, and double-blind placebo studies, and it's just a wonderful emerging, hopefully emerging field for our scientific minds to start to try and understand. And then the other thing, because we're running out of time, that I wanted to say about homeopathy that I love is the thought of like the never well sense. I just like never well since the dog got attacked by a dog, or never well since it's got a vaccine, or never well since something happened. That's such a cool thing, because in homeopathy you can go back to that moment and you can figure out what that patient needs to help go forward with this incredible healing process. And so, like you said, homeopathy is tapping the vital force, like acupuncture, like chiropractic medicine. We're just tapping the vital force to do what it knows it needs to do. Um, and then, sorry, one last thing I wanted to say too, which is that the another brilliant thing about homeopathy is the fact that it does work on that emotional, mental, and physical plane. And there's just not a lot of other medicines. Are there any? Are there any medicines? Maybe. I don't think there are any other medicines that can work on those three planes, in which You may have a dog with like massive anxiety or a cat that's peeing in the wrong place, and you can get that healing without suppressing through homeopathy. So it is a beautiful way to heal and an off ramp for those that are in the Western highway of, just doling out the drugs and not seeing the responses that you want and wanting to feel the joy of really healing. It's definitely an off ramp. So check it out.
And it is the joy of really healing because you get to see your patients really heal. And I have never been so happy in veterinary medicine as to be doing something where my patients truly feel better. We are not rushed. The clients are listened to. The animals are listened to. They have time. I talk about what exactly I'm doing. I have time to talk about it. Um, and then they start to heal. I mean, real healing, like Aaron just said, lots of times they have behavior problems. I'm not going to say you can fix every behavior problem. I'm not going to say that. And again, there are over 8,000 remedies, right? So it's a harder medicine in that there's more choices and you need to spend a little more time with it and you need to be pretty well yourself to be able to do it. So, um, I always have been seeing a homeopath too, like actually since my stroke. And the better I feel, the more I notice I can help my patients more. And
Absolutely.
I see animals that maybe were grumpy, maybe were crabby, maybe were really fearful, maybe were even attacky. Um, can that can all fall away, and they don't need anything else. I mean, of course, they need love and food and
Yeah.
water, the
Yeah.
appropriate,
But they
everything
don't need
appropriate, right?
suppressive medication. There's no suppressive medication that needs to be given for these animals because they're just showing us a symptom that we need to follow and figure out why.
Right. And I don't always, well, should I say something about humans or not?
Sure. Because
Um,
I personally, we have homeopathy listed on our resources website because there are people that are suffering from all kinds of things. And just like what you said, like if we can be healthy and feel good, we're just going to be better at our job.
And it's amazing how to feel well. I have this one person, actually, I saw this person recently, and they said, I have never felt this good about myself in my life. I actually never felt good about myself. And I actually feel good about myself. I've had multiple people say, I see a lot of people for depression. I see a lot of people for all the physical problems too, because we're vets, we're not afraid of it, right? So I see multiple people with kidney failure. Um, people with some severe disease too. But to see people all of a sudden, do you know what? I'm feeling happy. Do you know what? I'm not agoraphobic anymore. You know what? I like doing this now. Oh, do you know what? Now I don't mind cooking for myself. I mean, it's just you just start to feel better and then the energy comes back and then the good feelings, maybe you've never had them. Maybe they come back or they come into your body and maybe you've had them before and they were fleeting or whatever, but now they're back and there's just huge improvement. It feels so good to have people feel good and to have animals feel good. It's just the best thing. I,
Right?
I
Why would we get compassion fatigue and burned out when we're able to really work at the
right.
foundation? Heal?
Right. And when I worked at one of the clinics that I used to work at, every day I'd be looking across the street at the 7-Eleven going, I want to work there.
Yeah. Yeah.
Right. I don't
Well,
want to work at 7-Eleven.
one of my quiz questions, and my quiz comes back a lot, is do you find yourself Googling and dreaming about other professions? And that's one of the biggest things I've noticed and heard, like even within my own practice, was a couple of veterinarians saying, "Oh man, like if I could just go and do this, I'd be so much happier." And that's just so sad because of all that we suffer and how we have to get through veterinary school to think about, dream about, like saying goodbye to it um, is just sad. But so, yeah, so off ramp for holistic medicine if you're interested in it. And just really quickly, I think there's two schools for veterinary. Yeah, which is veterinary Homeopathy Institute, VHI, and then there's the Pitcairn Institute of Veterinary Homeopathy, pivh.org. So both of those schools, if you have any interest or thought this was a super interesting conversation, please check those schools out if you're a veterinarian.
And you can do the human school if you want to.
Like I'm doing because I wanted to really deep dive into it. Although I shall not be practicing on humans. I actually sent a letter to the director of the school and said, "Thank you so much. I love your school so much. You guys are so amazing. I just want you to know that I will be treating animals only." This this
And
this
you
school
know,
taught me I do not want to treat humans.
you're not the only one. There's a graduate from the early 2000s who's still a vet, who she's wonderful. She's fantastic. And she only does animals. She said, one time I was at somebody's house for a house call and I saw them acting a certain way. I'm like, here, you should take this too. She goes, but that's like it.
That's
She
it.
goes, I just don't. And really, we don't do homeopathy on humans that way. It was just an acute thing.
Absolutely.
So you don't, I mean, even it's just the experience of learning it in this much depth really makes a difference. It made a difference for me, and maybe my brain just needed a little more.
I
Um,
agree. I love the study of philosophy in it, and I have to say it's really, really hard. Like I've spent so much time studying and learning. So don't think you're going to go into it and take a short course and you're going to be good to go. Like it's a very intense, beautiful, beautiful healing modality.
so I want to tell you about how I ended up starting my own practice.
Yes.
I was working at a conventional practice, and I think I was taking the courses then, the Chinese medicine courses. And this didn't really have anything to do with the Chinese medicine courses, but I was seeing this dog, and he was a border collie, and he was very, very fearful. And I had to just spend a lot of time with him to make him not scared. We didn't do the druggy thing back then. And so, the fear-free kind of stuff where you give him the drugs ahead of time and all that. But I could see he was really scared, and I just sat on the floor with him and I just got to know him, and I was just talking to him. And he put his paw in my hand, and he was letting me examine him and everything. And I said, well, I have to draw blood for a heartworm test, but I really need to go get help. And I heard in my head, no, do not get help. And I didn't listen. And I went and got help. I went and got the person who worked at the front desk, who was the kindest and most gentle person in the practice, who was also a good friend. And I said, hey, can you come? And the dog jumped, lunged at her and growled. And she's like, what? I'm so kind. Dogs don't do this to me. And I said, it is my fault. He told me not to get somebody else, and I didn't listen. And then he looked at me and he sat down, he put his leg out, like,
Wow.
go ahead, go ahead. And then we were able to draw blood, no problem. Because I
Wow.
listened to him.
Yeah.
And I feel it. I could just feel his energy and everything. And I hadn't really had an experience like that before at that point, or not that I could, that was so obvious. And I thought, I can't do this anymore. I can't, because then I got in trouble. I got in trouble because I was taking too much time, because I took the front desk person away from the front desk, which is, I mean, that is a problem. There was somebody else at the front desk though who could help.
Yes. Yeah.
Um, and because we didn't have time for that, is what I heard. And I'm like, no, no, we need to have time for this. It's really important to listen to the animals. And I can't work at a place where the animals aren't being listened to. And the techs would, grab the cats by their scruff and flop them on on their sides, and say, no, just draw the blood. And I'm like, he's scared. Let's pet him a little bit. Let's not scruff him so hard. Let's try to be gentle. And it's just the culture, right? It was just
It's right. I
culture.
was going to say it's not the technician's fault. It's that
No,
they're under the
no,
gun to get this stuff done and to make their doctors happy. And so it is the culture
exactly.
of
Exactly.
move it along.
Right. It's not like any one person's problem at all. It is totally the culture where we're all stressed, we're all hurrying all the time, feeling like everything's too much. And I thought, I can't do this. I have to quit, because I need to be able to give the animals all the attention that they need, and really be heard, and have the people really be heard, and people not be stressed out and feel like you're not listening. And you don't get that doing this. I mean, even doing Chinese medicine, I had longer appointments, and people had time. to be listened to, and animals had time to be listened to. And it just was like such a relief. And I was so happy. I
Yep,
was so happy.
absolutely. I love it. Thank you for sharing that.
Thank you. Thank you for listening.
I want to thank you so much, Dr. Jody, for coming on Veterinary Compassion Project, for reaching out to me because I know you had a wonderful story and you wanted to join and help in any way that you could. And so I so appreciate that. And I look forward to more conversations with you. And I'll see you in class next year. She's my teacher.
I look forward to
Thank you, Dr. Jody.
Thank you, Dr. Aaron.
Bye.